Assalamu alaikum and welcome to the lecture on online pharmaceutical care provision and globalization in pharmacy practice. I am Shoaib Muhammad, lecturer in the Department of Pharmaceutics, Faculty of Pharmacy, University of Sindh. This is the outline of the lecture in which we will be having the introduction of the online pharmaceutical care, the methods for it, the drawbacks and the globalization of the pharmacy services. The chronic diseases are already having a lot of mortality in Europe, and this mortality is also becoming a challenge in middle and low income countries like Pakistan, Bangladesh, Afghanistan. And these demographic changes and the epidemiological changes that are present into these regions are also increasing the chances of difficulties in the treatment of these chronic diseases. Now, the increased prevalences of these chronic diseases suggest that the healthcare system and the people who are working into the healthcare system should have relationships with each other, and they have collaboration with each other so that they can integrately work together to solve the problems of the healthcare throughout the world. Day by day, there is change into the pharmaceutical services provisions. The pharmacist not only provide services or counsel the patients into the hospitals, but the role of the pharmacist also increasing into the community pharmacy, and they are guiding the patients when they are coming to the community pharmacies for the purchase of the medications. And this has increased the role of the pharmacist and the services of the pharmacist. Now, as discussed earlier, the prevalence of the chronic diseases into the European countries as well as the low and middle income countries has underpinned that the healthcare professionals should be in communication with each other, and that will help the problems of the health throughout the world. And in this, the information systems and technologies are playing a very important role. And nowadays, as the services of the pharmacist are also increasing, the information system technologies are imparting a very important role of pharmacist into the healthcare system. And now the pharmacist is able to provide the services through the internet. The pharmacist can provide the services through the online services. And e-health nowadays is one of the service that can be provided by the pharmacist. Now, what is e-health? E-health is the utilization of the information services technology to support health service provision, complying with the needs of the citizens, patients, health professionals, and other healthcare providers. Though the provision of services through the information technology is considered very effective nowadays, but even that it has many disadvantages. The online services have been very effective even during this COVID-19 outbreak, and various of the healthcare facilities has provided the services to the patients on a phone call or through a video call or through a chat. But the design of the services must be adequate to both practitioners, users, and it must be cost effective as well. The practitioners should be using these services or the apps which are available for provision of the healthcare services. It should be very useful or easily accessible or easily operable for the practitioners, and these should also be very easily useful and easily available for the patients as well. And of course, if someone is designing a app for the mobile or through a laptop application is designed, it will be maybe in sometimes costly. So if the cost effectiveness of this methods should also be made into the consideration. On the other hand, the utilization of an online health services has the potential to impact user behavior and perceived usefulness. Now, many of the people think that these online services may not be very effective. There may be the communication gaps because of the various problems. Now, for example, in our country, as we are doing the online classes, there are various disturbances. Even the many people do not know how to use the Zoom app. So similar kind of the problems will be faced by the patients. Similar kind of the problems will be faced by the practitioners. So all these considerations should be made for the e-health services provision. So here are the drawbacks of the online pharmaceutical care provision. The main barriers for pharmacist adoption of the online pharmaceutical services provision are lack of time. Of course, there is a lot of workload onto the pharmacist. It will be difficult for the pharmacist to take time for these online services provision. Time management, of course, the pharmacist has various other responsibilities. He will have to take time, manage time for this online services provision. The information system usage skills, the pharmacist must be provided proper trainings or must be trained effectively to use these technologies for the provisions of the services, as well as precise role of definition within the pharmacies. So what will be the services provided by the pharmacist through these online applications? What kind of information will be provided by the pharmacist? Through what channels he or she can provide the services? These all things are needed to be defined. These are still not clear. These problems can be addressed with proper training and services reorganization. So we have to make a new hierarchy, that who will be managing these online services, who will be working under whom, and all these structures are still into the working, and this service will be very effective into the future. So the globalization is basically the process in which people, ideas, and goods spread out in the world, spurring more interaction and integration between the world's cultures, governments, and economies. The globalization of pharmacy practice is only in its beginning, but it will grow even more over the next several decades for at least two reasons. Number one is every country seems to be experiencing similar problems with healthcare cost and access, as we discussed about the chronic disease problems. Uh, these are common in the European countries, and these are also becoming common into the middle and low income countries. In most countries, pharmacists are being recognized as key solution to address these problems. Now, as we have already discussed, the services of the pharmacist are more recognized day by day, and even in for the certain situations, the pharmacists also have been given the responsibility of prescription or prescribing the drugs or giving the treatments to the patients, like the traumatic situations, the emergency situations, or the earthquakes. The pharmacists have been given certain responsibilities. So these responsibilities and these effective services of the pharmacist are increasing day by day, and into the future the pharmacist will be involved into the global healthcare service provision. So this is all from my side. Thank you very much.